Hi, everyone. Welcome and thank you so much for joining us today for our Small Business Development Workshop, promoting positive mental health in the workplace. The Duluth Chamber is very grateful to provide this offering free of charge for our chamber members because of the generosity of our series sponsor, Big Superior College. They have been instrumental in allowing us to continue to bring these educational sessions to you to help grow your business. But without further ado, I have the pleasure of introducing to you our speaker for today, Rick Gertsema. Rick is a licensed psychologist serving as mental health senior advisor for the Miller-Dwan Foundation. So we know that a company that engages and empowers their employees matters. And Rick will provide today those strategies on how to make your workplace a healthier place overall. This is a relevant and important topic, and I'm very glad you're here.
Thank you.
This is also going to be an interactive conversation, so please stay with us throughout the session. And your participation is really going to make this a well-rounded workshop for today. So please ask questions along the way, and then there will be some time for Q&A at the end. So Rick, go ahead, take it away. Thank you so much for being here.
You're very welcome. And anybody who is in the meeting, please feel free just to throw in the questions at any time. I'm more than happy to be interrupted because it's not really an interruption. It's really trying to be timely and responsive. As Chris said, I'm Rick Gertsema, and I'm a licensed psychologist. My specialty work really was with adolescent boys, and I did that work really for a number of years. And I have worked in probably every level of care possible in behavioral health. And now the Senior Mental Health Advisor for the Miller-Dwan Foundation. I'm really excited to be able to talk about the topic of promoting positive mental health in the workplace. What we know is that as much as people would like to say we're post-COVID, I don't think that we're post-COVID. I think we're living in COVID, and I think we're still living the impact of COVID. And of course, we spend a great deal of our time at work. And so I think bringing this topic forward in particular is incredibly important. So what we'll do today is talk a bit about some mental health statistics. What I'd really like to do is give everybody a really nice backdrop in terms of what it is that we're really facing in the workplace, and then take from that information, talk about what on a company level can be done to help employees, and then start going through the tiers of senior leadership or business owners. What is it that leadership can contribute? And then what about managers? And what the literature really talks about and studies really talk about is how incredibly important managers and or business owners and or supervisors are, people who are really interfacing with the employees, what they can do, and then empowering employees. Then I'd like to shift the focus just a bit and talk a bit about remote work and how do we support people who are working remotely, either 100% or they're working in a hybrid model, which is, I think, here to stay, and I think we'll see more of that as we move forward. So I'm going to start with an attachment that Chris actually sent. And Chris, can you see my screen?
I can see it perfectly. Yes.
Beautiful. So this is Lyra, and Lyra is a telehealth organization, and they put together a state of the workforce for every year, and this is a 2022 report. And they surveyed over 1,000 employees to get this information. And my hope in sharing this information is that it will really validate what most of us potentially already know. It's a very lengthy report, and so what I really want to do is focus on these top 7 highlights, and I'll go over those briefly. So the employee mental health crisis truly is worsening. And if you see in the highlighted yellow, 84% of workers surveyed experienced at least one mental health challenge over the past year. which to me is an incredibly staggering number. And I'm delighted that actually that many people are identifying that they've had mental health challenges. And so this graph over on the right-hand side, end of 2020 survey, 40% of employees said that they were experiencing some anxiety. By the end of 2021, 54%. Stress, 58% in 2020, and then up to 63% at the end of 2021. Burnout, 29%, 32%, and depression, 23 to 25%. And a couple of therapist comments that I think are helpful. We're living through an unprecedented experience with COVID, and that comes with a lot of uncertainty. Our brains aren't well equipped to cope with uncertainty, so it's not surprising that people are experiencing mood symptoms as a result. What we know about uncertainty and perhaps a pandemic is our brains really can deal with something that is done and then we move forward. This is a sustained state of uncertainty, which I think really contributes to that sense of depression and anxiety. The next comment, in the COVID era of remote work, people are more isolated and some struggle to maintain boundaries between work and leisure time, which we'll talk a little bit about later. Without much supervision, people can procrastinate during the day, forcing them to scramble to meet deadlines and submit subpar work. The cycle of behavior fosters self-critical thinking, a fundamental component of depression and anxiety. So the first finding, employee mental health is worsening. The second, most employers are prioritizing workforce mental health. The vast majority, 92%, have said providing mental health support for their people became a higher priority for their company in 2021, and 93% said they expect it to stay that way over the next 3 years. I love that there's that kind of forward thinking, because I think that the mental health support is going to be critical. The third is employers really can break down the barriers to care. And I think this is, again, incredibly enlightening information. Younger generations of employers face more mental health struggles and are more likely to stay with employers that offer robust mental health support. And so employees whose mental health impacted their ability to work, and this is broken down by age group, which I think can be really helpful for employers, leaders, companies, business owners. Ages 18 to 24, 75% of the employees said that mental health impacted their ability to work. And so if you look at this group, 35 to 44, so 18 to 44, that's an incredibly high number. Employees who sought mental health support, 18 to 24, almost 50%. 25 to 34, almost 50%. It's nice that that number is creeping up to the 50%. And frankly, I think we could do a little bit better job in additional resources. And that's a bit of a Pandora's box. Yet, you can see how many people really are reaching out. And then finally, employees who said they would stay in a job because it offers robust mental health benefits. 18 to 24-year-olds, 25 to 34-year-olds, right around that 70% number. Employers overestimate their benefits' ability to effectively address workers' mental health challenges. There's a gap here in terms of perception. The benefits leaders in a company, 61% said their organization provides a wide range of resources. The employees, on the other hand, 29%. So really good information to pay attention to as you have time to sit down and read. For employees, comprehensive mental health benefits are fast becoming a requirement, not just a perk. People today are also more likely to leave their jobs at least partly due to a lack of meaningful mental health benefits. More than half of employees said, "I would stay at a job because it provides robust and comprehensive mental health benefits." The sixth takeaway highlights working caregivers bear a heavier mental health burden and need more support. Now, also an interesting statistic, we know that with COVID, one of the groups that has been most largely affected is parents who have school-aged children. And this really points to the impact of being a caregiver and being a full-time employee. The pandemic laid bare these realities as a growing number of caregivers, disproportionately women, either faced an impossible juggling act of full-time work and child care, and also points to elder care. So for those who have elderly parents or they're in that caretaking role and needing to take care of not just kids, they may have left the workforce altogether. So caregiver group, mental health declined 35%. Mental health impacted their ability to work for caregivers 65%. 59% experience anxiety, non-caregivers even 50%. And finally, number 7, workforce mental health demands an open, supportive culture if we're really going to move forward with a healthy work environment. And so the summary, the new world of work requires a commitment to workforce mental health. So with that, are there any questions about those first feedback? Anything that anybody would like to put in the chat would certainly be welcome. I find this incredibly enlightening information. Feel free to just put anything you'd like to in the chat.
I'm not seeing anything in the chat yet, Rick, but I
Okay,
do feel
beautiful.
like this is quite validating for some of the things that I've been feeling personally. So
Yeah, and that again, that would be my hope, is that as I share this information, that it makes a lot of our own internal process and the understanding of those that we work with, the importance of really that social culture, that work culture.
right. Whereas we do have a question. So when they're talking about comprehensive mental health benefits, are they referring to healthcare coverage or EAPs?
Or, I'm sorry.
Or EAPs, the Employee Assistance Programs?
All of the above. EAP, resources, and we'll talk about that in a bit. It's a great question. Thank you for asking. It really is about online resources. How are we able to talk with one another about mental health in the workplace? So that comprehensive package really is about how well we really support one another and the coverage, and are we making information available. These therapists, these providers are available in our own network. Here are some online resources that could be available to you. And one of the things that we'd like to do at the foundation is on our website, we're doing some work on our website, is really making it hopefully one of those one-stop shops where anybody would be able to just come to our website and be able to click on resources and check on symptoms of what does depression look like? What does anxiety look like? So any business or company, organization, that comprehensive piece really is the sort of the one click away thing.
Thanks, Rick. Another one, how is it best to promote EAPs and mental health coverage for staff? Adam says he has these resources, but utilization is low.
I think that's normalizing in the workplace. So In other words, I think it's just it's a open comment. It's bringing that forward in a very intentional sort of way. And we'll talk again just a little bit about that later. Except the more that we're able to speak openly about mental health, and we make it a normal part of our workday, the more that we can do that, the better.
Perfect. And one more.
Sure.
Jessica says, I know that therapist openings are out a few months. What's the best way to guide if an employee is looking for mental health support?
I think always starting with the primary care provider, and seeing if there's any resources that would be available there. What I do know is that there are a number of private practice people who really do have availability. So not thinking about in a sort of a different mindset, that they're really looking, and that's the importance of that website, that we really have one place where you'd be able to go and think, it's not Essentia, it's not St. Luke's, it's not HDC, the Human Development Center. What are the other possibilities, and what are the private practice openings, and really trying to create that so that it's a one step away for anybody who has those kinds of concerns, or they're looking for those resources.
Perfect. And another one.
All right.
You might touch on this later, but in addition to mental health support, what else are employers doing to alleviate some of these things for families, like flexible work hours, reducing the 40-hour work week, increasing wages? So is there research to show that these things are being added in addition to only mental health support?
There certainly is support for the flexible work day and flexible work hours. I was going to say especially for remote people, but I don't know that that's even necessarily the case. It could be hybrid workers. So yes, the flexibility is a piece, and yep, we'll talk about that just a little bit later. Great questions.
Perfect. Thank you.
You guys, I love this. Way to go.
It's really great.
I love it. We good with questions, Chris?
We're good with questions.
All right. As they pop up, interrupt me.
You got it.
So the information here forward, Mental Health in America, this is Mind the Workplace 2022 report. And this is perception of over 11,000 employees across 17 different industries. So as I was thinking about presenting today, what I really like to do is take what seems to be the most credible information and share and disperse that information as best I can. The findings reflect positive workplace mental health requires time, intention, and then action. And I think many times the time can be there and the intent can be there. The next step really is, how do we take action to actually move forward with initiating positive mental health in our workplace? The major takeaways: rates of stress and distraction remain high across all workplaces. And as I alluded to earlier, manager support strongly correlates. So managers or supervisors, depending on your organization or your business, it really correlates with employee empowerment and positive employee mental health outcomes. The conversations of, and legitimately meaning, how are you? How are things? How is work? So that really face-to-face person daily just makes a massive impact. And what we also know is that mental health awareness is increasing. Employee comfort levels, and somebody had this comment, employee comfort levels and their likelihood of seeking out workplace resources, there's an area for improvement. So from the big picture, talking about a company that cares about employee mental health really understands and is is able to articulate the relationship between mental health and employee engagement, and can also understand that if an employee is not feeling engaged, it may be because of some mental health stressor that's in their life. It's a two-way relationship. So as a company, as a business, you want to make sure that you're, as that is the owner of the business, that you really understand that there is a relationship. And a company identifies and addresses the primary drivers of stress and burnout that are specifically work-related. A company assesses the organization or the business's support for work-life balance. And that is on all levels. That's for everybody who's in your company, your organization, really doing an ongoing assessment. That's not a once and done kind of thing. It really is assessing ongoing, month by month. We all know that living in the pandemic, things change really quite quickly. And the company considers the physical and social work environment. So physical environment, I think we know that. We'll talk a bit about remote work. And so also being attentive to the social work environment, meaning that employees are connecting with one another. If we have hybrid people or if we have remote people, that there's also some sort of social connection. And so leadership. If you're in a large organization, this would be that senior leadership level. And I don't know how many people, it could just be a simple raise hand and take your hand down. How many people we have who are in leadership roles, senior leadership, not manager, one level above that, as much as I don't like hierarchical language. So leadership, this is for business owners, leaders. Establishing, oh, nice, thank you. Establishes employee mental health and well-being as an organizational strategic priority. So really putting this as a priority and raising it up front as a priority. Investing personnel, a budget, and resources to support that identified mental health strategy. And investing personnel, in this report specifically, they talk about not necessarily saying that you have to hire a person. There could be people within your business, your organization, who have an interest in really promoting mental health. So it could be X number of hours per week or X number of hours per month, but really investing in the personnel and then bringing in the implementation of that mental health strategy, and then communicate what that strategy is. So mental health is certainly one of our strategic priorities. We've invested this in personnel budget and resources, and then make sure that it's communicated clearly and effectively across all levels of the organization. And this is interesting, and I appreciate, speaks openly and honestly about personal mental health concerns as a leader. And this is going to, of course, vary across wherever somebody might work, except speaking openly about, you know, my daughter, my husband, my parents have really been having some struggles with anxiety or having some struggle, or my kids. What that really does, and what this specific call out is addressing, is the stigma and reducing. So the whole idea of stigma reduction, because it becomes the norm that we can simply talk about mental health on a day-to-day basis. And for leadership, developing supportive and emotionally intelligent managers, people managers. Really being able to have those managers who are connecting and understand and know what's happening with employees. And then also consider employees who do have mental health issues, mental health struggles, or substance use struggles, having them as part of our team, it really does create a more inclusive and equitable workplace culture. And then providing mental health training. Anybody who really is in this meeting today, this is a way that you would be able to say that it's tailored mental health training that could address employer and employees' roles in promoting positive workplace mental health. So I'd encourage anybody to share the PowerPoint. So managers. A manager who engages in these activities can contribute to a mental healthier workforce. Cultivate relationships built on trust and respect with direct reports. Before stepping into the Miller-Dwan Foundation, I was the manager for all of outpatient behavioral health. And one of the things, and I think there'd be a way to do this remotely, I had a daily huddle, a daily check-in, in which would talk about what was happening for the day. Was there anything missing, anything that we needed to anticipate? And I think that kind of connection on a daily basis really was helpful, and let everybody know that I supported and that we were all in this thing together. And how do we create, okay, here's our day, let's get started. Active listening skills and emotional intelligence. What I really think is, again, incredibly important. If anybody that we support or any day-to-day interactions, if somebody comes to talk to us, I think it's so important to look at the person, not multitask, not be distracted by email, not be distracted by, I got a text message, not looking at my watch, my Apple Watch, because I just got a message. Take that time to really spend time and demonstrate those active listening skills. The appropriate level of guidance and assist employees with workload management. This specifically is responding proactively and not reactively with workload management. If you as a leader or a manager have given something to an employee, one of your direct reports, and you know that it's going to be a big project, checking in with them. Is it going okay? Do you need any more resources? And talking about that openly in a proactive way before it gets to a point of it's too much, I'm tired, I don't want to do this anymore. So really giving the guidance and helping. And then notice if there's increased stress or burnout. And if you notice it, take action. Talk to somebody, reach out to that employee. And it's okay to tell people to take time off. If they need an afternoon, if they need to leave a couple hours early, if they need to take a day off, really encouraging employees. And to somebody's question earlier, this really is one of the formulas for that comprehensive mental health packages is also paying attention to time off, need for time off, and all of these bullet points. And as an employee, I need to be able to comfortably and confidently be able to provide constructive feedback to my manager about their performance. One of the things I loved about Daily Huddle was the comment of, Rick, I think you forgot something. It was so incredibly supportive of me, and that we're all incredibly human and that we need that feedback. Discuss and negotiate title, role, responsibilities, salary, workload, that really can be an open discussion that you'd be able to have with your manager or your leader. Being able to talk about those things openly. Be openly informed on a regular basis about the company's mental health services and supports. And then asking for any needed accommodations that support a mental health condition or a substance use disorder. Again, reducing stigma and being able to ask openly and not feel shame, guilt, less than because there's something going on, mental health issue or a substance use issue. Any questions about that section? How many managers, supervisors do we have, by the way? Raise the hands. That is always good information. Nice. Okay, several. Any questions about that section?
Not
Seeing any?
any questions yet.
Beautiful.
I do have a
Okay.
comment though, in that I've been involved in quite a few discussions about employee retention, because that's of course super important right now and relevant considering the workforce shortage. And so many of these bullet points that you're including are listed as retention strategies, and it's really about like respectful communication and two-way openness. And it makes so much sense.
Nice. I appreciate that. Thank you for that feedback. And clearly in both of these studies and surveys, engagement, retention really is about a healthy workplace, healthy mental health workplace. And so I totally agree. Those things they're so interconnected. And we're getting to a position now where we're raising that up as being a front and center kind of topic. So let's talk just a little bit about the mental health of remote workers and or hybrid workers and how to stay connected with technology. In this survey, 21%, 1 out of 5, 1 out of 4 of remote employees cite that they struggle with some feelings of isolation or loneliness. So things that we can do support the mental health of remote workers by helping them stay connected with Slack, Zoom, whatever your instant messaging platform might be. Being able, we have Teams, shooting off a Teams message, connecting with somebody. The more that is to break down that isolation and keep people feeling like they're connected. And keeping in mind that that's not the optimal way. The optimal way of really reaching out to somebody other than in person, face to face, are video. I think now the foundation team, I've been here about 4 months. They know that I'll typically just shoot off a message in Teams. I say, "Hey, can you take a Teams call?" Because that, and especially for a remote employee, it's so nice for them to see a face, to get a smile, to get some engagement. And it's not just looking down at the keyboard or staring at a screen. There's a person there. And I think that's relationship building. And it's also, it's going to help build and support people's mental health. And we don't have to talk and communicate just for work-related reasons. It's totally okay to check in on people. Again, especially the remote workers. How are things going? Ask the questions, lean in with curiosity. One of my favorite sayings, just lean in a little bit and talk and see face to face. So socializing virtually. This particular study talks a lot about socializing and the fun channels on your company's instant messaging platform. This is way outside my wheelhouse, but the people who are younger than me probably can figure this out pretty quickly. Common themes, common interests that you might have in your business or your organization or your own work group. So cooking, outdoor activities, sports. What about restaurant recommendations, activities for families, for kids? Set up a time and set up a channel in which there's that whole social component of how we're able to socialize with one another. And if you have, I think this is good practice with all new employees, regardless if they're face-to-face, hybrid, or remote, start up with a daily check-in. How are things going? How did your day go yesterday? If you want to check in at the end of the day, you want to check in at the beginning of the day, are there any obstacles? Is there anything I can do to help support you? And depending, I think it's just a really nice support. After that first week, you can start backing up a bit, but I think it's helpful, and we only get one chance to onboard. We only get one chance to really bring a new employee, and I think this is really incredibly critical work. And then for established employees, and again, especially remote, weekly check-ins are just a beautiful thing to do. How are things going? What are you working on? And that whole monitoring of workload, are there stress, the burnout? Are there any things happening in your family? Just those nice weekly, and it could be every other week. Certainly leaders, managers would know, business owners, you know the people that you work with, and as you get to know them, maybe it is once a month. Yeah, I think that's, and even if it's once a month, that's still incredibly important. And then that small talk and personal conversation during those check-ins. And then intentionally bringing everybody together for a monthly meeting. That can be done virtually. It doesn't need to be in person. And then the whole idea of activity. We know that activity and physical fitness supports overall mental health. And again, to somebody's comment, a comprehensive mental health really is having physical activity or supporting physical activity while at work. Making sure that people take breaks. Take a 15-minute break in the morning, 15-minute break in the afternoon, get up, move around, stretch. If there's something that was particularly stressful or difficult, when you're done with that meeting, stand up, stretch, go for a little walk. So really encouraging that taking breaks. Larger organizations, companies, wellness stipends, or built into a benefits package where there could be some incentive for participating in activities. And then that online fitness resources. And here's the flexibility. And again, this is outlined more in this study survey. Employees who work 100% remote, they do so because they need flexibility or want flexibility in their schedules. So there's this whole pocket of information about if somebody still wants to work 40 hours a week, could that be done in 4 days? So that 4-day work week concept, for people who are particularly busy, where they work during school hours. So they work, and then after the kids go to bed, they sign back in, and do, so they might work a 5-hour day and then do the other 3 early morning, later in the evening when the kids are doing homework. So really having some flexibility, and that's really those check-ins and the conversations and spending time with employees. So really understanding the flexibility that they may need in their life is really incredibly important as well. And then rewarding good work. This is especially true for remote workers. For people who are 100% remote or hybrid with a lot of time at home, not so much time interacting, it's really hard to get, you can't check in person. There's no chance just to pop in and say, God, you really did a great job. I really appreciate that you did that. And so if it's all written word and you're not doing video check-ins, it really can lead to a lack of confidence, because you might not be sure how you're doing as a new person, or how you did on a project or a presentation. So really recognizing and taking 3-4 minutes, 2 minutes, and reaching out to remote people and saying, that really was stellar. Thank you so much. It could be an email, it could be a message, and yet the face-to-face, of course, is going to be the most powerful tool. And here's that work-life balance. When working remotely, 100% remote, hybrid remote, encourage that work-life balance by setting up a specific place in your home, in your apartment, as, quote, the office. That's a dedicated space. That's what your brain goes to when you sit in the chair, that I'm now at work and I'm now in my office. Working only that set number of hours each day. I think one of the dangers of 100% remote work is, well, you know, I'm at home anyway, I'll just finish this last little thing, and then it turns into half hour, 45 minutes, an hour. So really making dedicated whatever your hours of work are, and that also probably would fit in with that flexibility piece, only working that set number of hours each day. And then when you're done, shut it off, shut it down. If you have PCs, shut the PC down. If you're working on a laptop, shut the lid of the laptop. Really, and again, very intentionally, this is the end of my workday, and now I'm going to spend time with my family, my kids, activities, whatever you have going on outside of work. And make sure to take those breaks. Remotely, get up, walk around the block if it's too cold outside, like it never is. You can also hop on a treadmill, whatever it might be. Just take those breaks and make sure that you take time to eat, take lunch, have healthy snacks, and then plan some in-person events. I think at this point in COVID, this is getting much more likely. Monthly team meetings, some kind of a gathering, trying to gather your work group, your unit, whatever the case might be, get-togethers. And they may not start as big, popular, large events. The point is to at least get started. So way back to the beginning, taking action, making sure that we're taking action. I love this idea. For those of you who have remote workers, invite them to go to a conference with somebody who is an in-office or hybrid employee to really start building those very same connections. I think it's a great strategy. And finally, share mental health resources. And that's those therapists, the services that'd be covered by your company's benefits. The mental health hotlines, especially now with the creation of 988. The 988 suicide and crisis prevention number is a national number in which you call, it goes to the 988 center, and they will then transfer that call to as close as your own regional area as possible. So you really are talking to somebody as close to local as you can possibly be. Mental health resources for local shelters, treatment centers, and then educational online resources that describe signs, symptoms, and steps to take for mental health. This is, again, one of the things that we at the foundation are hoping to create in our new website, so that if I was wondering if my child or my parents were struggling with depression or anxiety, I could go, be able to click, see signs and symptoms, see some of the things that I might be able to do, maybe some mindfulness, maybe some breathing, maybe just so making that available for all those that we work with. And then, of course, telehealth, which is a whole nother resource and likely has availability, which is a resource that we don't often think about. When I was still manager in behavioral health, we flipped our entire clinic in 1 week from in-person to tele. And mental health, behavioral health is one of those areas in which this really can work, especially for therapy. And so really being informed of telehealth providers that could be local, and if not local, it might not make as big a difference anymore because we have these connections. And so that's my 45 minutes. I did pretty good. Nice, right? So any questions that anybody might have?
We do have a question here, Rick. Do you have any tips for small business owners that are overwhelmed with trying to balance employee support and options, but also feeling like the financial burden falls on the employer?
Specifically regarding
Employee resources and how to help someone within a smaller business.
I think always the first step is having the open conversation with employees and finding out exactly what resources they're looking for. So that's always step number one. What can I do to help? Is there anything I can do to help? So again, it's that leaning in with some curiosity and saying, I know that we all have mental health issues and mental health struggles, and they pop up. So just step forward, ask the question, and sometimes that one short conversation can have a huge impact, and then gauge what it is that person really might be looking for.
Perfect, thank you.
Yep.
We also have a request for the PowerPoint. Might I share this PowerPoint with our attendees after this?
Yeah, would you please? That would be great.
So Sarah, what I'll do is we're recording this today. I will send out to everyone the recorded session so you can rewatch it or share it again. The PowerPoint and the report that we sent out this morning that Rick referenced earlier today, that will be included as well.
And as you can see, my email is also here, or I'm on LinkedIn. If people have questions or you think about something after we're finished, absolutely. Comments, if there's anything that you believe that I could have added, could have done differently. I love feedback. The more, the merrier.
Perfect.
Other questions?
We still have a few more minutes, so feel free to pop those questions in the chat or head on video and audio, and we can get those answered for you.
One of the ways that I know that I'm in a healthy, supportive mental health environment, I told Chris, this is so funny. Well, number one is humor, right? We all have to have a good sense of humor. And then when you join a team, you're joined by a mini-me who always sits right behind me. And I tell you, this is just, it was one of those beautiful, incredible, nice gifts that is such a lovely extension of how we care for one another and how we support one another. Bring that piece of humor, bring that connection into the workplace as much as you can.
I'm glad you shared that. Thank you.
I can't not, because sometimes people will say, is that a little you over there? Yeah.
Yes,
yeah. Mm-hmm.
Well, I'm seeing some chats that say thank you and empowering information and excellent presentations. So Beautiful. If we're not seeing any additional questions, thank you so much for coming today. We can stay after another minute or two, see if anyone else wants to pop on, but otherwise, I appreciate you being here, spending your afternoon with us. And like I said earlier, we will go ahead and share the information with you following this presentation. So have a wonderful afternoon. Thank you so much, Rick.
Thanks, everybody. And I'll stay on for a couple minutes.
Perfect. I will too.